we are moving forward to the inclisiran group of drugs, the VICTORIAN initiate study. Now, as you all know that we are focusing on lower and lower LDL goals. The Lipid Association of India has brought down the levels of the LDL targets down to as low as 45 and 40 in the patients who have atherosclerotic cardiovascular disease. And PCSK9 inhibitors, inclisiran particularly, as well as the Ripatra, have shown that there have been benefits in reducing LDL while also keeping the statin doses as low as possible. Now, this trial was designed in patients with atherosclerotic cardiovascular disease who did not achieve the lipid goal in spite of the statin therapy. And a lot of centers enrolled patients and they were followed up for 330 days to look for whether the lipid goal was achieved and also in relation to how many patients were able to tolerate the statins. Now look at the endpoints here, the percentage change in LDL was 7% in the statin group, whereas it was a remarkable 60% reduction in the treatment arm, which was on the inclisiran arm. And look at the time this separated. As soon as we started using this, by 90 days, you start seeing this benefit. And immediately, you see this benefit persists as long as the drug is continued. Now, how much, when you started inclisiran, how many patients maintain less than 70 of LDL? 81%, and less than 55, 71%, compared to 22 and only 9%, which is our target actually for these patients with atherosclerotic heart disease. So if we are talking about reducing future events and LDL targets being one of the main reasons in which your atherosclerotic events reduce, then this drug can be a game changer in terms of having recurrent coronary events. And of course, the safety profile was quite favorable. So LDL lowering first with inclisiran, first strategy led to a sustained LDL cholesterol reduction at 330 days as well. And the safety outcomes were quite encouraging in the real world setting. This just highlights the importance of starting this drug early and the urgent need to improve this as part of the regular care in our atherosclerotic heart disease patients.